This will be SB 1012. You may begin when you're ready.
Thank you very much, Mr. Vice Chair. I'm presenting SB 1012, which will provide regulated, supervised access for people 21 and older to certain psychedelic substances under the supervision of a licensed and trained facilitator. In the Business and Professions Committee, I committed to amend this bill to limit the licensure of facilitators to those who already hold other certain licenses. So we limit it that not anyone can get a license. You have to have an existing license. And we have not put those in print yet, given the tight timeline, but we will do so at the earliest possibility. SB 1012 is a narrower version of legislation that the legislature passed last year, SB 58, which would have broadly decriminalized personal possession and use of certain psychedelic substances. Tragically, the governor vetoed SB 58, but in his veto message, he constructively called on the legislature to send him a bill focused on therapeutic use of psychedelics. We immediately got to work on SB 1012 last fall, working with a broad range of stakeholders, including the Coalition on Psychedelic Safety and Education, which a group of parents that had opposed SB 58, and we have worked with them, and they are supporting this bill. And we worked with them to include a first-of-its-kind public-private education fund to foster to make sure that people have education and information about safe use of psychedelics. And again, that coalition is now strongly supporting this bill. SB 1012 is an overdue approach. People are using psychedelics today. There's incredible potential in terms of treating mental health and substance use disorders, and we should bring it into the sunlight so people can use safely in a supervised, structured setting, and I respectfully ask for an aye vote. With me here today to testify are Lieutenant Diane Goldstein, the Executive Director of the Law Enforcement Action Partnership, which is a co-sponsor of the legislation, and Dr. Brian Anderson, a board-certified psychiatrist at San Francisco General Hospital and assistant clinical professor at UCSF, and founding investigator at the UC Berkeley Center for the Science of Psychedelics.
Thank you very much, Ms. Goldstein. Nice to see you again. You have 2 minutes, please.
Pleasure. Distinguished members, my name is Diane Goldstein. I served for 21 years as a police officer, retiring as the first female lieutenant in my agency. As a sergeant, I led a multi-agency special investigations unit that focused on narcotics, gangs, and career criminals. I'm currently the executive director of the Law Enforcement Action Partnership, who is also a co-sponsor of this bill. Policing professionals have recognized we can no longer rely on arrest as a means to address a public health issue. Saving lives and reducing the crime and disorder caused by underlying problematic drug use or behavioral health issues are not mutually exclusive. A response that can achieve both ends requires a paradigm shift towards evidence-based practices that closely link public health and enforcement strategies with their most important outcomes, saving lives. First responders that suffer from PTSD or other behavioral health disorders stand to benefit from access to these services. This is particularly true for police officers who suffer traumatic stress at a rate 5 times higher than that of civilians or have a 54% higher risk of suicide. We have some of the highest rates of spillover violence that results in excessive use of force, domestic violence, alcoholism, and substance use disorder. We owe it to these police officers to ensure safer access to alternative avenues for healing so they have the choice to heal rather than to just numb themselves to the daily traumas they experience on the job. SB 1012 will craft an actionable plan for the regulated use of psychedelics as an issue of public health. This bill is a first step towards saving lives by helping destigmatize cutting-edge treatments for the underlying mental health challenges that drive addiction and other behavioral health issues while providing needed guardrails and safety to access treatment. In addition, there is a strong provision for the establishment of a public education fund to educate those who are currently or in the future will be using psychedelics on the risks and benefits of these substances. This bill does not decriminalize psychedelics, but from a public safety perspective of the cities and jurisdictions and states that have implemented therapeutic models. Thank you very much.
Thank you. Next speaker, you have 2 minutes also. Thank you.
Good morning. My name is Dr. Brian Anderson. I'm a public psychiatrist and a scientist who studied the medical and non-medical uses of psychedelics for over 15 years. My research is funded by philanthropy and the FDA, and my words today represent my opinion and not those of my institution. I and other clinicians and scientists have worked with Senator Wiener's office to draft SB 1012 because it addresses an important public health issue. We know from the U.S. federal government that millions of Americans use psychedelics every year. Their health and safety can be improved by having access to a state-regulated system through which they can access safety screening, informed consent, preparation, supervised use, and follow-up. I think that SB 1012 could decrease stigma regarding psychedelic use and make it easier for patients to talk to their doctors about their use, as well as make it easier for healthcare providers to provide counseling on safe psychedelic practices. This bill would set a national precedent for how a state-regulated psychedelic facilitation system could prioritize public education, as well as make it easier to hopefully collaborate with other forms of conventional licensed healthcare, and most importantly, improve the safety of the many Americans, and particularly Californians, who will be choosing to use psychedelics in non-regulated settings, particularly non-FDA-regulated medical settings in the future. Thank you.
Thank you very much. At this time, we'll take primary witnesses in opposition. Any primary witnesses in opposition? Mr. Sherman, you have 2 minutes.
Thank you, Mr. Chair. Members, Ryan Sherman with the California Narcotic Officers Association in opposition, as well as all the police and deputy sheriff associations listed in the analyses. We remain concerned about and opposed to SB 1012. However, we support the efforts to help vets and first responders suffering from PTSD. Regrettably, nothing in this bill has to do with vets, first responders, or PTSD. There's no requirement limiting this bill and the access to these psychedelics to vets and first responders. There's no requirement limiting this bill to persons suffering from PTSD. In fact, no mental health diagnosis of any kind is required before a person can be given ecstasy, ayahuasca, mushrooms, or mescaline. No medical history review by a doctor is required. No medication conflict check is required by a doctor. The facilitators established under this bill are not required to be medical doctors, although some medical doctors may seek to become a facilitator. Pursuant to the Business and Professions Committee hearing, alcohol and drug counselors would be permitted to be these facilitators, even though they don't have advanced training or degrees or medical license. Many of the alcohol and drug counselors are addicts and alcoholics themselves. Having them oversee the dispensing of psychedelics is just mean, tempting them to relapse. In closing, there's no PTSD or medical or mental health diagnosis from a medical professional doctor required. There is no medical doctor or providing supervision or prescribing these drugs. To dispense these Scheduled 1 drugs, that are prone to abuse. For these reasons, we remain strongly opposed to the bill in print. Thank you.
You have 1 second left. Thank you. All right. Do we have another witness in primary opposition? You have 2 minutes.
Great.
Thank you.
Chair and members, my name is Greg Burt from the California Family Council, and we also have grave concerns about the harm this bill will cause to our state citizens. As a public safety committee, you are charged with the responsibility of keeping public safe from drugs considered dangerous and harmful. Our state and federal government has already set up an elaborate, well-regulated safety system that includes scientific testing and well-educated doctors and pharmacists to ensure that the drugs sold and used by the public for mental illness meet high standards for safety and effectiveness. Senator Wiener is here today saying that those safety standards are too high for a particular drug, category drugs called psychedelics. He thinks these drugs deserve a special exemption from all the safety rules that everyone else has to follow. He has created new protocols for oversight that, in my opinion, simply give the appearance of safety, but in reality remove sound science from the equation. The bill enables recreational use with the appearance of medical respectability. There is no reason to doubt the sincerity of the veterans and others desperate for medical treatment for mental health issues like PTSD, but notice that Senator Wiener isn't talking much about all the veterans and those with conditions that were only made worse by these drugs, or those who are rushed to the hospital for heart issues, seizures, amnesia, acute anxiety, and terrifying hallucinations. Senator Ashby, in the chair of the Senate Business, Professions, and Economic Development Committee, recommended a no on this bill. She expressed strong concerns. She noted the bill was setting up a complete marketplace for the drug with 3 new departments or agencies overseeing production, distribution, and sale. I thought we had a deficit. She also pointed out that the psychedelic facilitator doesn't need to have a medical degree or oversee the use of these drugs. Facilitators also have no access to patient records to make sure that the conditions these patients might have might make these drugs make things worse. Local jurisdictions have no local power over regulating these facilitators like they do with marijuana.
You've had your 2 minutes. Sorry.
And thank you very much.
Thank you very much for your testimony today. Okay, at this point we will take Me Too's for people that are in opposition or are in favor of the bill. Please come up, state your name, state the organization you represent, and whether you oppose or support the bill. Thank you.
Mr. Chair and members, Anthony Molina on behalf of Heroic Hearts Project, New Approach Advocacy, the Steinberg Institute, and the Sacramento Institute for Psychotherapy and Support. Thank you.
Duke Cooney on behalf of ACLU California Action and Support. Thank you.
Julie Nielsen with the National Union of Healthcare Workers with the promised amendments in support.
Alice Mike on behalf of the California Public Defenders Association in support.
Mr. Chair and members, Corey Salzillo on behalf of the California State Sheriff's Association in opposition.
Rashid Koja, Director of Policy for Veterans Exploring Treatment Solutions, and we are a co-sponsor of the bill and urge you to support. Thank you.
Thank you. Dylan Elliott on behalf of the California State Association of Psychiatrists, and with your very brief indulgence, Mr. Vice Chair, I just want to express we remain concerned with the bill, but want to thank the author for his continued efforts in working with us, including with respect to our meeting next week. Thank you.
Phil Melendez, Smart Justice California, in support.
Okay, is there anybody else that wants to come up? If there isn't, we'll bring it back to the dais for questions.
I move the bill.
Okay, we have a motion by Skinner to move the bill. I have some questions. Okay. So you and I have talked about this bill before because I have grave concerns about expanding the ability for people to alter their minds and then go out into the public with their altered mental status. As a former public safety professional, I am well aware of the PTSD issues that are pervasive in both police and fire departments, as well as the extreme issues with a lot of our military people that are coming back and our veterans. In talking to them, while they do seek treatment, they do not seek to be made the poster children for these type of expansive bills. Some of the testimony I heard today, frankly, concerns me because it goes beyond what I had talked to you about, was a very, very narrow window for treatment of PTSD and other psychoses that were previously unable to be treated with other methods, and it had to be done under a doctor's supervision. This didn't sound like a doctor's supervision. It sounds like a licensed clinician type of situation. And then also during the testimony, I heard from your witnesses that this is more of an effort to enable it to go on a wider scale for people who want to just use it, and at least they'll have to be supervised. The problem I have, and in my experience with people that have taken psychedelics, is that there are occasionally times when they have a very delayed response or a recurrence of the psychedelic that they may have taken before. And so while they may be under supervision during the immediate time period, they may have a relapse out in the public that may be misconstrued and create an incident with law enforcement. And when those go bad, we all know what happens. So I am not at a comfort level with your bill, that this is something that has more benefits. I want it narrowed way down to where it is an extreme treatment by a doctor, and that's where we need to limit it. I do not feel that it is beneficial for the public to have more people than we already have that have altered mental statuses. And also, the other concern I have is that's also a very good way to get out of a crime, is to say that you were under the influence of something and you didn't know what you were doing. And that's not good enough for me. So in order to maintain public safety, I'm going to have to oppose this bill. And I'm sorry, because I really, I wanted that effort for the PTSD-stricken and extreme cases where that may help, because there are cases where it did the opposite and it turned people schizophrenic. I read on those. And so, sometimes it helps and sometimes it doesn't. But it has to be done under doctor supervision, and I don't think that this does that. Thank you. And with that, you may close.
Thank you, Mr. Vice Chair. I appreciate your thoughtful feedback and appreciate the opportunities that we've had to speak about this, and I definitely will stay in touch. Colleagues, I think we need to be very clear that right now, as we speak, many people are using psychedelics. Some use it recreationally, some are using it to save their lives. We have a whole coalition of veterans, first responders. We had a firefighter at our last hearing we had a 9/11 firefighter fly out here for the last hearing on the previous version of the bill last year. These folks are telling us that these substances are saving lives, and right now they're faced with a choice of either committing a crime to heal themselves or leaving the country to heal themselves. We should not be putting people in that position. We should be bringing this into the sunlight with regulated, facilitated, supervised, structured use with safety evaluations that will make it safer than it is today. I respectfully ask for an aye vote.
All right, and with that, this is